competency-based undergraduate curriculum, explain the anatomical basis of liver biopsy, site of needle puncture, obstructive jaundice. Describe and identify the microanatomical features of gastrointestinal system and liver. And describe the development and congenital anomalies of the foregut, midgut and hindgut. This chapter includes gross anatomy, histology and development of the liver. Today you will, I'll just give you an outline of the liver and a কটা রেখেছি specimen? চারটে রেখে দে, চারটে ট্রে, চারটে ভালো করে ধুয়ে দে। And you please see, main thing in gross anatomy, in your viva, it will be in the tray. Now, if you get a chance, you go for the liver. You don't go for spleen or something. Of course, if you are kidney, এই চারটে তো মানে main intestine তো একটু দেখে দিলে এটা হলো। But main focus, you have to focus everywhere, but every organ, every system. But I'm telling the most commonly the examiners ask is the liver, kidney, spleen, uterus, and its appendages, means the ovary and fallopian tubes. Okay. Now, pancreas, these are to be in your mind. Because see, all these 5 organs are what I told you is that mostly there can be a question on the microanatomy of liver. That means the histological features that can be. Second thing, you are in theoretical. So, but in gross anatomy, it will be identification of liver. Ki holo, kar ki holo? হ্যাঁ ঠিক আছে, গান টান শোনো, কত অসুবিধা কিছু নেই। হ্যাঁ, আর কেউ যদি ভিডিও কল করে থাকে একটু পারমিশন নিয়ে, কারণ নেটওয়ার্ক নাও থাকতে পারে। হ্যাঁ, বাইরে গিয়ে বলবে স্যার আমি একটু বাইরে যাচ্ছি, ঠিক আছে? না, ইট ইজ পার্ট অফ দি গেম, ইউ হ্যাভ টু অ্যাকসেপ্ট ইট। Now, see, you have to hold it in anatomical position. That means it is a next. See, the total, the right hypochondrium, epigastrium, and the left hypochondrium. This is the mid-clavicular line. These are the and transpyloric plane. This is the umbilicus. This is the liver. Now, what happens usually, if there is an enlargement of liver due to some pathology, there is enlargement, there is jaundice due to hepatitis, but a cirrhotic liver will be not enlarged much. In children, the liver is enlarged. At birth, it's enlargement in the abdominal cavity. You can palpate it. You can see when the baby is taking the respiratory movement. You can see it is moving. Another thing is enlargement of the spleen. Also, you can palpate from. You have to palpate from the right iliac fossa, and you go like this, and you see the margin. But the margin is there is notches are there. So you can differentiate between a splenomegaly and hepatomegaly. Hepatomegaly, the liver is enlarged with sharp borders. And now you see the liver border is there. Now it can extend up to this part. It can be enlarged. The spleen can come down like this. Okay, this is one thing. Second thing, see, this is 7th rib, 8th rib, 9th rib, 10th rib, 11th rib. Now for any fine needle aspiration cytology, for fine needle aspiration cytology, FNAC, fine needle aspiration cytology. In between 10th and 11th, you put a needle and take it out. It will come out, the tissue will come out. The needle is a big, not just a white board. Now you take out and put it in the slide, fix it, and accordingly it goes. You stain the slide and this thing. Now, to hold this organ, there are some ligaments. The falciform ligament, then ligamentum teres hepatis. These are the main ligaments which you will see in the liver. You see the undersurface of the liver, there's the fossa for the gallbladder, there's the quadrate lobe, right lobe, left lobe. These are the main components. You just rattle. So this is the borders you just describe. The superior surface is round contour, left side is triangular. Don't hold don't see the blood supply of the liver. The vessels are lying on the vertebra. The abdominal aorta and the vena cava, it's all in the posterior. So you will see the vessels and the passages for the vessels. That will be posterior. When you hold it like this, you see, this is you can see the gallbladder will be here. You just hold it, you see the superior surface, lateral surface, the anterior surface, posterior surface. It's all contour, it's smooth. But you see the undersurface, you will see some irregular patterns are there. By the lobes, the quadrate lobe, the fossa for the gallbladder, and the gallbladder itself is there. Now, sometimes the examiner asks you, what is this? You just don't get puzzled. You say, the green biliary stain, bile stain, green. You will see that portion is having green stain. But in living body, when you are operating, you won't see any stain. In the dead body, you will see because it is cut, bile leaks, and that gives a green color there. But the fossa for the gallbladder is having the gallbladder there. The quadrate lobe, right, left, and all ligaments. What are the ligaments? What is it? The ligamentum teres, very prominent, and falciform ligament. When you see the body, now the liver intact, it is not taken out, intestine are taken out, you see the anterior surface, the ligament is there. And now, some interesting facts. The proportional weight of the liver is more in children. One is 18th of the body weight, then the adults in one is 36th of the body weight. This is because of the hemopoietic function of the liver in fetal life. Liver is called hepar in Greek, hence many structures related to the liver are termed hepatic. Now, this is just for your own interest, or you answering very well. You have crossed 80s, 90, now you are reaching 90. The examiner will give you 90, gold medal. Now, that time he might ask, what is the difference between a fetal liver and your adult liver? Now see, External features: the superior surface, the posterior surface, the anterior surface, right lateral and visceral surface is here, visceral inferior border. This diaphragmatic surface. This, see here the diaphragm separating the thoracic cavity. This is diaphragm separating the thoracic cavity from the abdominal cavity. Now, 5 surfaces: anterior, posterior, superior, inferior and right. 1 border inferior. Anatomical lobes: right lobe, left lobe, quadrant lobe. Okay. Now, some interesting facts. Factors keeping the liver in position: hepatic vein, major factor that open into the inferior vena cava. Hepatic veins, major factor that opens into the inferior vena cava. Intra-abdominal pressure, ligaments of liver, less important. Liver is essential to life. Even surgical removal of 2/3 of the liver is compatible with life. Now, if there is a metastatic or some big hydrated cyst of the liver, that is due to the worms, the cyst forms. Now, it can be that portion of the liver or the cyst removal. But that is done, see, it bleeds. It bleeds. It is very vascular. Now, usually, big hospital where there's liver transplant is being carried out, or portion of the Center for Liver Diseases. So, they have harmonic knife. That's a knife that cuts through tissues but doesn't allow to bleed. It's it's very costly. Okay. Now just note the name. Just it is for your own interest. Now so one thing is that the hepatic veins, major factor that open into the inferior vena cava, factors keeping the liver in position, intra-abdominal pressure, ligaments of the liver, less important. Liver is essential for life. Even surgical removal of 2/3 of the liver is incompatible. Next. Now you see, hold the liver in such a way that the groove for the inferior vena cava on the posterior surface of the liver should be vertically straight. I told you that. Now, broad base of the wedge-shaped liver is on the right. This now smooth convexo-concave convex surface, convexo-concavo-convex surface faces upward, this whole portion. Now, the surface of the liver has 5 surfaces and they are anterior, posterior, superior, inferior, right. Inferior surface is well defined and called visceral surfaces. Why visceral surface? All other surfaces are ill-defined and continuous with each other, hence they are together called parietal surface of the liver. Now the parietes, when you open the abdomen, the parietes, you remove, in the dead body you see the whole abdominal cavity, the intestine, the colon, everything is removed. Then that cavity, that are known as parietes. And if the colon is there, then there's the paragolic gutter. Paragolic gutter is there. So the right colic flexure, the cecum, ascending colon, right colic flexure, transverse colon, left colic flexure, and goes. Superior surface is quadrilateral, it is convex on the right and left with middle concavity and cardiac impression. Superior surface is separated by diaphragm from lungs, heart and pericardium. Anterior surface of liver is triangular. It is divided into anatomical right and left lobes by the attachment of falciform ligament. Relation: the anterior surface is related to the following structures: the diaphragm, the 6 to 10 ribs on the right side, lower margins of the right lung and pleura, 7th and 8th left costal cartilages and xiphoid process. These are the boundaries and relation. Here, the superior, right and left is the inferior surface. Now, the notch of the ligamentum teres hepatis. See the falciform ligament and inferior border, the fibrous appendix, this, and fundus of the gallbladder, the cystic notch for ligamentum teres hepatis. এটা একবারে আজকে দেখে নাও, পরীক্ষার দুদিন আগে দেখে নেবে, মানে পড়ে নেবে, আজকে শেষ করো, এখন দেখে নাও 12টা আধ ঘন্টা দেখে নাও মেইন জায়গাগুলো একবারে তুমি ধরবে, তোমাকে তো একটা চয়েস দিয়েই দেবে, ড্রেতে থাকবে, নিলে দেখালে মানে মুখ বন্ধ করবে না। তোমাকে যা নম্বর তুলতে হবে ভাইভাতে 15, 10, 11 যাই থাকুক, কিন্তু তুমি abdominal viscera you must pick up first. Pick up means according when you go, don't panic. Don't panic. Now see, if you everything is there, the falciform ligament, ligamentum teres hepatis. Now falciform ligament, you see the peritoneal folds come like this shirt, like this. It's like this. If you see in the dead body, you will see it's like this. And the teres hepatis, ligamentum teres hepatis, it's cord-like. It's cord-like. একটা কর্ডের মতো এরকম, not hole is there, it's a cord. আরে যে ট্র্যাক প্যান্ট গুলো আছে না, তারপর সেগুলো তোমার your shoes, he's wearing Crocs. Anyway, cord-like structure is there. That is ligamentum teres hepatis. The total covering the liver like this. This is like this. That is your falciform ligament. The gallbladder is there. Fundus of the gallbladder, ligamentum, notch for the ligamentum teres hepatis. Now see, if you are asked a full question for 10 marks, describe the liver, then this is the diagrammatic features. See, left lobe, this is the falciform ligament, it's a peritoneal fold, and ligamentum teres hepatis. Yeah. Fundus of the gallbladder, ligamentum teres hepatis. এখন শুনো, বই, ট্যাব, খাতা, বই থাকলো, ট্যাব থাকলো, যার যেরকম আছে, ল্যাপটপ থাকলো, ফোন নিয়ে হবে না। You will fall asleep, the writing is small, you go on expanding. Don't waste time, don't waste time. You have to put these things, at least if you don't have a tab, you don't use the phone even. You have one book of Inderpreet Singh, whoever it is, they are very good books, Chaurasia or some, I forget his name every time, Yogesh, whatever it is, you write, you just draw, sketch, that imprints in your brain. You are drawing, এমনি করে পড়তে যাবে ঘুমাবে, so you in this last lap you keep on drawing. Yes, sketch this, মানে you don't have to be a Kala Bhavan artist. I told you earlier in the first in your when you were attending first time your classes. Now go to the thing, please see, you have half an hour more. There are কটা দিয়েছিস? 4টে, তাহলে গ্রুপ 4 জন করে কটা আছে? 5 জন 6 জন করে দেখে নাও, তাড়াহুড়ো করো না। ব্যাগ আমি বলে যাচ্ছি, তারপরেও ব্যাগ নিয়ে চলে যাচ্ছ, আমার কিছু এসে যাচ্ছে না। আলটিমেটলি আই এম টেলিং ইউ দ্যাট the more you see, তোমার ইমপ্রেশনটা থেকে যাবে। কিন্তু আমরা কেন আজকে এই জায়গায় এসেছি, তাও এই 68 বছর বয়সে এখন অনেক কিছু ফেল করছে, কিন্তু 2 বছর অ্যানাটমি রুগড়েছি, তারপরে আবার 2 বছর পোস্ট গ্রাজুয়েটে রুগড়েছি, তখন এসব বই ছিল না, Grace and all the others, McGregor and whatever. But I'm telling you this That much content of anatomy is not required. 1.5 years was okay, but I'm telling you, 1 year they have done, you have to pass through. All the boys have passed. Your dadas and didis have passed. So don't bring that fear psychosis. Fear in you. Na amar holo na, ami ar parchi na, ekbare dube jabo. Don't. So wish you all the best. তোমরা আমার ফর্মুলা নয়, এটা জগৎ বিখ্যাত ফর্মুলা। ছবি আঁকো, লেবেল করো, বই দেখো, ট্যাব দেখো। কিন্তু এবার কি হয়, ট্যাবের ব্যাপারগুলো কি সবটাই ইমপ্রেশনটা ফোনটাই ধরো, ফোনে যে তোমরা টাইম নষ্ট করো এটা দরকার নেই। ভাববে ফোন নেই, আর ফোন নিয়ে তো তোমাকে কলেজ ঢুকতে দেবে না। পেলেই তোমার এবছর দেখো সব জায়গায় মানে ইউ উইল বি নো চান্সেস অফ কপিং ফ্রম এনি সোর্স। আর ইউ জাস্ট গো, চলো এই 4টে ট্রে আছে, 4টে লিভার আছে, তোমরা নিজেদের মতো করে, বাচ্চা ছেলেরাও তোমরা নিজেদের মতো করে পড়ো, নিজেদের মতো আলোচনা করো, ট্যাব দেখো, বই দেখো, খাতা রাখো।